Welcome to ACL Hot Minute, episode number 7 with me, Mick Hughes, coming at you. Now today I want to talk to you about something that is becoming genuinely dangerous online, and it's the normalisation of injectables in young men, in particular peptides and testosterone. Now I'm going to focus this one in particular on testosterone, but both peptides, BPC 157 and testosterone boosters are certainly being targeted and marketed to young men haphazardly, and it's problematic, very problematic, and in particular young men who don't have had no formal diagnosis of low testosterone. When we start mucking around with our hormonal system in our body, we can have a significant impact on other parts of the body that we probably won't know for many years to come. And what we're seeing in particular when it comes to tissue harms is that, ligaments, tendons can be compromised with supplementation of testosterone. So I want to tackle this one today because it's certainly an important topic, and particularly young men have high incidence rates of ACL injuries. Obviously young women too, but certainly it's this growing dangerous trend of testosterone boosters in young men that I wanted to tackle today. And I definitely want to make it clear that this isn't targeted towards men who have diagnosed low testosterone. They've gone through the appropriate channels of seeing their GP, getting some blood work done, and identifying that cause. This is the unregulated and untested process of injecting testosterone. I've recently saw a person online promote that he promoted it in a way that it seemed okay to be taking test or PRP for health and well-being measures, and that alcohol, drugs, cigarettes, these more harmful drugs and other illicit substances, they're bad for you, and seemingly made the connection between peptides and testosterone to be good for you, and it was pretty it was a problematic statement in my mind, and I certainly wanted to jump on and get in front of some of these messages and hopefully share to my audience the dangers of taking substances, particularly when they're marketed as wellness or health and well-being, that have been unregulated, or they're being taken when you're not really needing it, in particular testosterone, and particularly young men who often got an abundant source of testosterone. So so without further ado, let's get into the paper that really shone a light on this one. So this was a paper published by Quinn and colleagues in 2024, and it was a retrospective analysis of nearly 500,000 people. So 425,000 patients were in each group. One group had in the last 12 months had testosterone injections for whatever medical reason. The other half did not, and we looked at men aged between 18 and 59 years of age, and then they were followed up for 1 year to see was there a risk of ACL injury between those that had testosterone supplementation or those that didn't. And the headline was pretty sobering. It was that there was with this huge study of nearly 1 million people, so we've got 850,000 people in total, so big body of work here. The headline finding was that people receiving testosterone boosters were significantly more likely to sustain a first-time ACL injury. Now, adjusting for lots of different factors within the study, the odds ratio was there's a 2 times greater risk at 6 months post-injection, nearly 2 times greater risk at 12 months, and about 1.85 times greater risk at 24 months. So the sooner the injection, the more likely of ACL rupture. So it hovers around the 2 times mark regardless of 6, 12 or 24th month. But the primary risk period is certainly in that, the high risk period is in that first 6 months post-injection. So in plain English, the people that received a testosterone booster have about double the odds of a first ACL tear. Now, it is important that this study did not find any statistical significant increase in ACL reconstruction failure or revision risk. So this is predominantly talking to, or really only talking to, people that have never had an ACL injury, have an injection of testosterone, and then over the next 6 months to 2 years, their risk is increased. So not talking to the crowd of people who have already had a reconstruction, although there is a paper that I won't go through today, but there is a paper that shows re-rupture rates or re-injury rates are high. But in this particular paper, in this particular setting, there was no findings there to suggest that testosterone booster led to graft failures. A really sobering statistic there. So it does really, it gets us really to a point where we need to be considering the role of these injectables. Peptides come into the conversation, although they're more in line with recovery, muscle building, tissue repair. That's why people are taking it. Not necessarily for muscle growth gains as what testosterone would be predominantly used for. But nevertheless, there are links here. This isn't a prospective randomized control trial. It is a retrospective design, so we have to be cautious with how we interpret these findings. But it is one of 2 papers in the last 2 to 3 years that has started to show a concerning trend in both primary ACL injuries and graft failures. And in particular, the 18 to 60-year-old audience. And in particular, it's a conversation we need to be having with our healthy young men who would be taking this to help with their physique or their strength or the way they look in the mirror or the way they perceive themselves. So please share this paper. The link to the full text paper is at the link below. It's a really serious topic. I'm not afraid to get out in front of people and question the use of these injectables, especially when we don't often do the basics well first. And it's not to say those that are already doing the basics really, really well, they need to go ahead and take these extra supplements on top of that. But I think there's a really important role that us as health professionals, we need to be promoting and advocating for basic strength and conditioning processes for ACL injury risk. We now are seeing a trend where if we have these injectables, we are increasing the risk of ACL injury. We have seen these known risks with other injectables such as cortisone injections around tendons. So we're just now starting to see another injectable that can potentially do harm to our patients. So it's not the funnest topic to talk about, but one that's super important for us as health professionals to get in front of, and particularly if we're dealing with young men who are involved in sport and who are taking testosterone for aesthetic purposes as opposed to really true purposes of improving their testosterone levels when they're already low. So like I said, share this paper, share this video, give me your comments, thoughts, feedbacks. Would love to hear it. And as always, thanks for subscribing to Mick's ACL or the ACL Hub. And thanks for watching these ACL Hot Minutes. I hope they're valuable. I hope you learned something new. And as always, stay fit and healthy. And I'll catch you next time.